Hello and welcome to Steward Healthcare's third installment of the live chat series. This online series is designed to give members of our community direct access to elite surgeons and specialists from across the Steward Healthcare system. And you, the audience, will have a chance to ask these experts your own questions and hear their responses during this program. Today we're going to focus on women's health, specifically breast cancer. We'll be joined by noted specialist Dr. Charu Taneja, breast surgeon at both St. Elizabeth's Medical Center and at Morton Hospital, and Kelly Tuthill, breast cancer survivor and WCVB TV5's award-winning reporter. At the end of the chat, we'll give you the opportunity to ask Dr. Taneja and Kelly Tuthill your questions about breast cancer. We'd like to thank you for submitting your questions online. We'll do our best to answer as many of them as we possibly can. And please, if you do think you have a question as you're watching the chat, you can simply type in your question. We'll be monitoring the questions as they come through, so don't be shy. Now I'm going to turn it over to our panel, Dr. Taneja and Kelly Tuthill, who will share with you a little bit about themselves, their background, and why they're here today. Dr. Taneja?
I'm a surgical oncologist. I did a fellowship in surgical oncology and got interested in breast cancer because being a woman, you tend to empathize more with women, and you realize that when somebody is going through breast cancer, they really want to be able to talk about all aspects of their care that are important to them, not just what they feel like, what to expect with the treatment, but what to expect 5 years after treatment. And I found that I liked having that relationship with my patients, and that made me go into surgical oncology, and here I am.
And Kelly, our audience knows you as a fine reporter who's covered many important stories in Boston, but I'm sure you never thought this story of your own problem with breast cancer would ever be part of the news.
No, that was never part of my career plan or life plan. I was diagnosed with breast cancer in 2006. I was 36 years old and a new mom. I had a 6-month-old baby, so it really surprised me to be diagnosed with breast cancer. I did not expect it. I had no family history of breast cancer, and I had to make a decision of what you do with that. And as a television news reporter, I thought perhaps we could do something positive with this and give people information and ultimately hope. And 7 years later, I hope I have given hope to a lot of people.
You certainly have, and I've seen it where people will come up to you now and say, my daughter was just diagnosed, what do I do? And you're always so helpful. You really have done a lot for others. It is wonderful having both of you here today. And now let's begin our discussion with our first hot topic, mammograms. How often and at what age should a woman get a mammogram? There's some controversy about that.
There's actually a lot of controversy about it. For somebody who does not have any risk factors, doesn't have a family history, we recommend starting to doing mammograms at age 40. Once a year, every year. Till you're about 80 years of age, some people go with 75, but the main thing is if you're in good health and you have no other significant medical problems, it's reasonable to keep doing them even as you get older, because breast cancer actually increases as you get older. A couple of years ago, there was a big controversy in the newspapers because everybody came up with, do you really need to do them between 40 and 50 years of age? Again, because breast cancer gets more common as you get older. But what we do know from a lot of studies that have been done, not just in this country, but in other countries, is that doing mammograms saves lives. So you may be picking up less cancer. It is a little bit of expense to the healthcare system, but you're saving lives in young women who have a long, productive life ahead of them.
Kelly, had you been a regularly had you gone and had mammograms done?
I was too young. So being at age 36, I hadn't had the opportunity to have my first mammogram. I had it in the worst case scenario, which is when you know you're going to pick up the cancer at that point. So I hear all the debate about this, and I'm going with the doctor on this. I think she's got an excellent perspective. I'm afraid that all these studies and all the different things that keep coming out in the news are just going to give people an excuse not to get a mammogram, and that concerns me greatly. I understand the debates, and younger women tend to have dense breasts, and that's part of the debate over this. But I think the bottom line is 40 sounds good to me. And who wants to be the one person that we said, your life didn't...
Not important,
yeah, not
right?
important. No, based on all the friends that I know who've had it, let's get the screening going. It's not a perfect test, as you know, I know, but it's the best we've got.
So it wasn't a mammogram that told you you might have breast cancer. What was it?
I found a lump. I found my own lump, which is very common. I think, you know, talk about another hot topic, breast self-exams. But I think, I always say, you know your own body. And if you see something or feel something that doesn't look right or feel right, you got to talk to your doctor about it.
Well, now on to our next topic, dealing with cancer once you have been diagnosed. And Kelly, I know you have firsthand experience on dealing with it. Can you share a little bit about the journey and where it took you in your treatment, and also the support of friends and family and what that made to you?
Yeah, well, it's a very devastating moment to have a doctor, even a great doctor like this, tell you that you have breast cancer. And I think many people feel very frightened and unsure of what the future is going to bring, what kind of treatment and what impact is it going to have on my body, on my ability to take care of my family or to get to work each day. And I think once you work on assembling a team of doctors that can help you know what to expect and help you get through it, all of a sudden you start to, as I always say, get your mojo back and you face it head on, because you have no choice. I mean, it's your life we're talking about, and you got to do what the doctors tell you to do and take those tamoxifen pills, which I'm still taking, by the way, all these years later, because it is important. And I always will take any little percentage increase that it will save my life, because I don't want this cancer to come back. So, you get a good team, face it on, and be strong. That's all I can say. It's tough.
And you mentioned the team approach, and Dr. Tanisha, I'm sure if you look around the country, there are other people who might be a single doctor and want it to be that way, but what do you think of that idea of having a team on your side?
You definitely need the team on your side. When you're treating breast cancer, it's not just one doctor. You have the medical oncologist, the radiation oncologist, you've got the radiologists who are doing the mammograms, who are helping you figure out how big is it, could it have spread. You've got the pathologists who are really giving the medical oncologists all the information that they use to say you need treatment A versus treatment B. So it is a team approach. You also have the reconstructive surgeons, which unfortunately a lot of people need down the road. And having that team at your side, knowing that all these people are looking not just at what's happening to me today, but what's going to be best for me 5 years or 20 years from now, I think you really need that confidence of saying, these are people who work well together, who are working together for me.
I was going to ask you, as a doctor, is it reassuring for you to have other good opinions?
Absolutely. I think what we emphasize is, and a lot of institutions do this, you have a tumor board, you review everything together. So if one person didn't think of somebody else, you've got the other people thinking for you, and you take advantage of their expertise. So when you go through the process, you have a built-in second opinion. And I think as a patient, it's reassuring to know my doctors are talking to each other. I don't have to be in charge of saying all my 5 doctors need to know about it. They're talking, they know what's going on with me. And as much out of control as you feel with your life, it's reassuring to you have that backup, that you don't have to keep dotting the I's and crossing the T's every time.
Right, and I always tell people, don't forget, your oncologist knows some stuff about surgery, and your surgeon knows some stuff about oncology and radiation. So if you're torn about a particular part of your treatment, you can ask all of them. And I think you get a lot of good opinions, like you said, a built-in first, second, third, fourth opinion,
Absolutely.
Which is nice. The team,
Yes.
You need a team.
You do.
Well, thank you so much. Such an important topic, and one that can be very confusing to navigate through. And it's so appropriate that we are having this discussion, as October is Breast Cancer Awareness Month. Could you both share with us your personal involvement in getting the word out about breast cancer? Dr. Tanisha?
I think, I don't think there's anybody who's listening to this talk who doesn't at least know one person who hasn't been affected. We all have family members, close friends who've gone through this. It's the most common killer of women. Lung cancer is catching up, but breast cancer is still one of the most common cancers of women. And anything that we can do to help raise awareness and say, take care of yourself, go for your mammogram. If you feel something, don't ignore it, I think is very important. We do what we do professionally, but I think it comes down to every person advocating for themselves.
Don't you also take some of the young students to join in the
We
effort?
do. We actually have medical students, residents who work with us, learn with us. And then I think even if they don't go into surgery, which most of them don't, carry that message forward. So if you have a primary care physician who's very aware of what you need to do, it's wonderful.
And Kelly, I know how involved you have been. It's really become part of your life.
Yes, it has. I mean, I think, first of all, we all have to be so grateful we live in the greater Boston area. Maybe there's some people who are outside of this area, but come visit us, that's fine. Because the institutions are amazing. You can't go wrong. You're so blessed to have so many talented doctors and nurses in one metro area, and so we're so lucky to have people like Dr. Tanisha here to take good care of us. It's a comfort in that. Beyond that, for me personally, trying to support the research that many of these people are doing in our institutions, because that's the key to getting the next best treatments that are going to save lives. So I support research, and then the comfort. I work with the Ellie Fund, which is in Needham, and try to help them.
Just tell us briefly, I think that's a great thing you do with the Kelly. It's called Kelly for Ellie,
yes.
And you do it once a year.
I do. We have a fashion show fundraiser, and the money goes to women in our community and their families going through breast cancer treatment, and the Ellie Fund, which is based in Needham, helps them with meals, house cleaning, rides to the clinic to get your treatment, whatever they need. It's a really no red tape kind of organization, and hospitals like St. E's and Morton, they refer their patients to the Ellie Fund. So the social workers help to make sure that these women and their families can get some help.
And how much that can help, just that little thing, having a meal made for you and your family.
Absolutely.
Rather than having to worry about it. Well, it's very inspiring to hear both of you talk about what you're doing, and we certainly thank you for your part in fighting against breast cancer. Let's now turn to our online audience and answer some of the questions you've had. And we'll take a combination of questions that have been coming in real time during the chat today, along with those that have been submitted in advance. A lot of people, or a lot of women, are concerned that if they have anything done to their breasts, including even a mammogram, or even wearing a bra with wire in it, can somehow increase your chances of getting breast cancer. Dr. Tanisha, what do you say to that?
No, it does not increase your risk of getting breast cancer or of having things show up in your lifetime. A lot of people worry about mammograms, and what I tell women is if you fly across the country, East Coast to West Coast, you got as much radiation as you're getting with a mammogram. And the mammogram's doing you a lot more good. So just do it.
Kelly, do you hear stories? Do you have people ask you
Yeah.
questions like that?
I think there's a lot of myths out there about breast cancer and what can cause it. I mean, I know the doctor, maybe, people say soy.
Yes.
Should I, someone like me who's had breast cancer, should I not eat edamame and drink soy milk?
No. And unless you're living exclusively on soy, a normal amount of soy in your diet does not affect your risk. We used to actually go crazier about should you be on birth control pills if you've had breast cancer, and we found from following women who are genetic risk carriers that it does not significantly increase the risk, so it's still safe to do it. The only thing that we do know is from studies done as part of the Women's Health Initiative that hormone replacement therapy does increase your risk. So of all the things that people worry about, that's the only real risk factor.
Dr. Tanisha, should women take hormone replacement therapy, HRT, or is there a link with breast cancer?
It is a significant risk, and I think part of the education process is also saying try alternatives. Look at symptoms, what is bothering you, and say what else can I use for this. There are certain people who will still need the hormone replacement therapy, but if you look at individual symptoms of menopause and try to manage each of them individually rather than lumping everything together, a lot of people can avoid hormone replacement therapy.
Here's another question from our audience. And what are the various options for treating breast cancer? And are there more now? It sounds like it from what Kelly was telling us, many more than there were 20 years ago, say.
They are. They still kind of range from breast conservation to mastectomy. There's a lot of more options with reconstructive surgery. There's also a lot of more promising technologies with trying to do microwave ablation, trying to do cryoablation, so you're minimizing the scarring on the breast itself. They're somewhat more experimental, but they are out there, and I hope to be talking about them 10 years from now.
Yeah, Herceptin was a drug that I took. I was HER2 positive, and when you get diagnosed with breast cancer or you work in the field, you start to learn about the different types. It's not just one type of breast cancer. So for me, a drug called Herceptin was really a targeted therapy that it attacked my sort of aggressive, as they call it, breast cancer. So that was a really good drug for me. And as I said earlier, I still take tamoxifen, and it was until last year that you took it for 5 years. And just last year, the studies started to show Maybe we ought to do this 10 years and give those women on it a few more percentage chance of their cancer not coming back. So that's something, and so much of this as we talk, I think, it's, you gotta talk to your doctor, because some people maybe, they don't wanna be on tamoxifen for 10 years for a variety of reasons. Maybe they don't. But for me, I sat down with my doctor, we had a discussion, I said, okay, I can do 5 more years of this. And that's the kind of conversations, HRT, you need to just talk to your doctor, because it's about the individual patient.
So you had chemo, you had surgery, and you had radiation, which you say was actually the most difficult. Can you say why?
Well, for me, I mean, not as if losing your hair and having chemotherapy wasn't difficult enough. Losing a breast and a mastectomy, difficult. Reconstruction, all that. There's a lot of challenges that go with this. It was a difficult year for me. All I said was that people will tell you, oh, radiation's, it's easy at that point. It doesn't hurt. It's fairly quick. But I was out of steam at that point. Mine almost was a calendar year, so I started in January, and so it was October. And I really felt out of steam. And I think sometimes when we're watching a friend or a family member go through treatment, you think, oh, at the end, they're okay. That may be when they need the most support. And as they come to the end of their treatment, they may be feeling like, I have no net. There's nobody's going to help me now. I'm going to be on my own, and I'm just going to wait for this horrible thing to rear its ugly head again. So sometimes when we're supporting people with cancer, toward the end of the treatment might be the time we all rally around again, because they may be feeling very vulnerable and spent at that point.
I have read that people, when they're mostly even more worried when they're off their treatment and they have a feeling that they're not doing anything that's actually going to help them. So there's a feeling of loss when you get off. Is that true?
Very true, and I have to say, Kelly, that was a very good comment to make, because we try and tell patients, as long as it takes you to get through treatment, it will take you as long before you feel like yourself, before you can go through a day and not think of yourself as a survivor, but as a person. And I'm sure for you it took a good year to get your energy and your stamina back. And I think that's the hardest thing, especially for young people with cancer to deal with, is the fact that you've been told, you're done, you're fine, you don't feel fine, and you do worry about it. So having that support, even when people say, you should be back on your feet, no, it takes time, and you do need that support at that time.
Absolutely.
There was a lot of talk this fall about Angelina Jolie's decision regarding her own diagnosis and her going under the knife by choice. What did you think of that as a decision?
From what I read, I would say it was the right decision for her. She came out in public and said that she knew that she carried this mutation, which put her at a very high risk. 80% was her estimated risk, and that made her choose to have prophylactic surgery. And I think for a young person to prevent breast cancer, prophylactic surgery, knowing you have that high risk, is a very good thing to have done. I think certainly she, being the person she is, helps raise public awareness that she was willing to talk about it. But it's not the right thing for everybody. I think it always comes down to the person and their choices. For some people, even knowing they have that risk factor, they may choose just to be on very close follow-up and say, when it happens, if it happens, I'll deal with it at that point. So it still comes down to an individual decision and what you're comfortable with. But I'd be interested to hear what you thought of it.
No, I thought, well, first of all, anyone who's open about the choices that he or she makes is great, because that's how we're giving other people information. And then what everyone has to take from it is that's her situation, and it may not be mine. First of all, not everybody gets genetic testing in the first place. Not everybody's positive for genetic testing. I mean, I get all the time, somebody will be diagnosed with breast cancer, and they say, well, should I have them both prophylactically removed, both breasts? And I always say, you need to really talk to your doctor about that. Angelina Jolie made that decision because she was an 80% chance of getting breast cancer. That's astronomical. She lost her mother, died very young, and she has all those children. So for her, I was probably in some ways a no-brainer. You pick your life. And what I love about her story is that you see it, and she's the epitome of sexuality, sex appeal. Let's say it. So I think all of us can say, she can make it look good, and we can be okay with the choices that we have to make, a potential reconstruction or no reconstruction or whatever. It's about our lives, and you make the best choice you can because you want to live through this. And she makes it look good, and we all can learn from that it's still sexy. It's a part of your body that you have to make a choice about because you're sick. But you can still be you, and you don't have to give up your femininity because you have breast cancer.
Going back just a little bit to discovering that you have breast cancer, how often should a woman, or your doctor often says, how often do you do self-examinations? What credence do you give to self-examinations?
It's a difficult area. I think for a lot of women, even people who are very self-aware, a lot of times people don't know what they're looking for. I think the key is knowing your body. If something feels different, if you're sure it wasn't there before, act on it. Ask your primary care, your gynecologist, or if you have a breast surgeon to check it out for you. Age doesn't matter. Having gone through it at a young age, if something feels different, it's better to check it out. Breast self-exam, like I said, most people don't know what they're looking for, what they're feeling, so I always tell them, look for a change. The best time to do a breast self-exam is right after your period, rather than before your period when everything feels lumpy. So if you're going to do it once a month, that's the good time to do it.
Can benign cysts ever turn into breast cancer?
They do not. If we've checked them out, we've done ultrasounds, we know they're cysts, they do not turn cancerous. The challenge again is you feel something, you don't know if it's a cyst or something to worry about.
When do you consider a woman, and Kelly, I'm sure you've been over this many times in your mind, when do you consider a woman in remission and it's really over and they're considered cured?
We're not going to like this answer. I can tell you, all our viewers are not going to like this answer. You answer it, and then I'll tell you my take on it.
I think it's a very different question. There's different kinds of cancer. There's some cancers where you have a very high risk of recurrence within the first 5 years, and your risk goes down to almost nothing beyond that. Other cancers seem to be more favorable, but they can recur 20 years later. So it's a lifelong process, and that's why I think there's so much more emphasis on survivorship, because you're never really going to go back to being risk-free, no matter how many years you are out. So if it's a bit of a waffle, I'm sorry, but that's how it is.
Well, yeah, I don't use that term. I don't use the term remission. I just say that I was successfully treated, haven't had any problems since. And that's sort of the easiest way that you can, because the public wants to know, your friends want to know, your family wants to know, were we done with this? And then you have to learn to live with a little bit of discomfort. And that's hard. And that's something that gets easier with each day, because there's always a possibility, but you have to get strong within yourself to say, I have done everything the doctor said. And that's important. A lot of people, they want to stop taking the pills. They don't want to, I can't go to radiation today. I've got a big business meeting because you want to get your life back. These things are important. You have to do the course of treatment and then hope, pray, and feel confident everything's going to be okay.
Kelly, you've done so beautifully. I'm wondering if you have any advice for people in the audience who, I'm sure they're the ups and the downs. What do you do in the down moments? How do you get yourself out of it?
Yeah, it can be very difficult. For me, everyone has a different personality and how they want to deal with this. I'm an extrovert here, big shocker. So I needed a lot of people around me. The worst thing for me was to be at home and isolated. So when people say, well, what can I do? Let me know what I can do. Come visit me. Come visit me. I don't want to be at chemo alone. Come with me. Someone else, that's a different, that may not be what's right for them. But, your friends that ask you, would you like to go get a manicure or a good cup of tea or whatever you and your friends like to do. But I think for anyone to stay a part of the active world, if you can't work, that's okay. I mean, you need to know your own body. I chose to work. That's how I felt alive, and I felt like I could stay up for facing the next day. Whatever it is that's for you, some people, quiet walk in the woods. If you need to be alone, that's okay too. Sometimes you need to say to everybody, everyone's got to take my kids today. I need to be alone. I need to recalibrate a little bit. But to really be thoughtful about what you need, and don't be afraid to tell the people around you, this is what I need right now. This is what I'm feeling right now, to talk. Don't isolate yourself. That's the worst thing you can do.
Terrific advice from both of you. I can't thank you enough. That was really engrossing and important information that you gave us.
We're just about out of time, but I would like to thank Dr. Taneja and Kelly Tuttle once again for their time and their insights today. It's been informative and inspiring to hear from both of you. And if you or someone you know is interested in this topic and would like to learn more, please visit our website at steward.org/livechats. steward.org/livechats. And there you will find this video, and you can also visit the St. Elizabeth's and Morton homepages for additional information. We hope you will join us again for Steward's next live chat series. Thanks for watching.